Hey guys, it's Chelsea. My organization was the American Heart Association. Within that organization, there were a lot of diseases and disorders. I chose to focus on the peripheral artery disease. Little things we're going to cover a little bit about the American Heart Association, what PAD is, some of the risk factors, signs and symptoms of peripheral artery disease, the diagnosis and prognosis, implications for the PTA, and also volunteer opportunity that's coming up for it as well. All right, so what is American Heart Association? So it's a not-for-profit organization funded by private contributions, and the goal is to provide info to public on prevention and treatment of heart disease and stroke. So with that being said, American Heart Association funds cardiovascular medical research, helps educate consumers on healthy living in order to reduce disability and deaths by the cardiovascular disease and stroke. All right, PAD. So what is peripheral artery disease? Basically, it's a narrowing of the peripheral artery, mainly most common is going to be in the legs, but the artery is going to be serving the legs, stomach, arms, and head. PAD is known to be caused by atherosclerosis. It narrows and blocks arteries in the regions of the body. So the process of it, first plaque builds up, narrows the artery. If the plaque does become brittle, it might rupture and trigger a blood clot, and that clot can narrow the artery or completely block it off as well. Some risk factors are going to be the elderly, patients with diabetes, family history of PAD, high blood pressure or high cholesterol, smokers, as well as obesity. Some signs and symptoms. The main one is going to be leg pain. So unexplained leg pain or cramping, usually during walking or exercising, is also termed claudication. So claudication is going to be cramping, pain in the leg, which is caused by too little blood flow, usually during exercise. In men, usually with diabetes, one of the signs and symptoms are going to be erectile dysfunction, gangrene, which is death of a tissue, poor nail or hair growth, usually on the toes or the legs, and also decrease in temperature. So usually just of the lower extremity of the leg or the foot, especially when compared to the opposite. Diagnosis. So diagnosis here is going to begin with the physical examination. The healthcare provider will check for weak pulses in the legs. The examination may include any of these. So the ankle brachial index is what we learned in class. So I'm just going to cover quickly a few of the other ones. The Doppler and ultrasound imaging, that one's going to visualize the artery with sound waves and measure blood flow in the artery. The magnetic resonance angiography, or MRA, gives info similar to a CT scan without using any x-rays. The angiography is an agent which is injected into the artery, and x-rays are taken to show blood flow, arteries in the legs, and pinpoint any blockage that's going to be in there. Prognosis. All right, so prognosis, what I listed here is just some things that they might be looking for. Something that most patients learn to live with is usually how this goes. So symptoms can improve, but the big question is how long it will last. So peripheral artery disease is hard to reverse, but you can definitely slow it down. A lot is going to depend on the patient. Are they not smoking? Are they exercising? Are they taking their preventative medications? Are they kind of changing their health lifestyle there? Everybody's going to be different. It just depends on their lifestyle and if they're willing to change it. Patients with diabetes, however, they're going to have to work much harder. Implications for the PTA. So first you want to try some treadmill or walking exercises performed first. Usually if any pain subsides, you kind of want to take them off, have them break for a couple minutes, and then they can go back on. Go back on though once that pain is gone. If they don't benefit from the short duration of walking exercises, then they can move over to maybe seated aerobic exercises. Something simple like neck stretches, seated rows, toe taps, knee lifts. PTA also wants to take some safety precautions. So be aware of any new signs and symptoms that may arise. Be aware of any abrupt increase in claudication symptoms as well. Make sure the PTA needs to assess legs and feet for indications of critical limb. Make sure to ask the patient about sores or pain. If they already know about some, make sure that they're assessing them more frequently. And also the PTA needs to evaluate the skin's color, hair, shininess, thinness, and if it's fragile as well. One of the events that is coming up, a lot of them have been postponed or to be determined, but one of the more recent ones I found was the Los Angeles Heart and Stroke Walk. one happening in Pasadena, one in Long Beach. That link there is just going to be a direct link to the Los Angeles Heart and Stroke Walk. So what they do here, if you're participating in the Heart Walk, you are raising funds for science, and with that science, it can teach us how to live longer and be healthy for good. All right, guys, thank you very much. Hope you all enjoy the rest of your day. Thank you.